There is ample opportunity for patients and growing a practice. I probably could have saved myself a lot of time just if I'd come here first. Probably 10 years of my life.
This is the time. This is the place. This is the life you and your family will enjoy calling home. Granville Health System is a locally owned and operated healthcare organization serving 200,000 people across 4 counties in North Carolina. Over the last decade, Granville Health System has seen tremendous growth and currently offers services that once could only be found in a big city setting. There are 125 physicians on staff, including 32 active physicians and 93 consulting physicians practicing in 27 medical specialties. As our community continues to grow, Granville Health System is committed to grow with the community. Though big city medical centers are nearby, we proudly offer the quality of care one could expect at a major medical center, but do so close to home. And that's where our story begins, at home. Centrally located in North Carolina, just an hour north of Raleigh, you'll find Oxford, the county seat for Granville County, the epitome of small-town charm from a bygone era, but with nearby urban amenities. 3 hours to the west are the North Carolina mountains, and 3 hours to the east are the North Carolina beaches. You can spend a day in Pinehurst, putting around on premier golf courses, or you can spend a day shopping for beautiful furnishings at the furniture capital of the world, as both are just 2 hours away. And you will find a wide variety of housing options to use that newly purchased furniture to include everything from new house construction to historic home renovations. And your options include planned communities, a historic district, established neighborhoods, or rural farmland. Here you will not find pollution, traffic, or noise. But when you want to venture out for social and cultural experiences, you don't have that far to go. Metropolitan shopping, collegiate and professional sports, fine arts and performing arts, gardens, more great golf courses, and an international airport are less than an hour's drive. This is the perfect community to raise a family. A community that thrives on activities for all kinds of interests, to include an active community theater program, multiple athletic parks, parades, recreational lakes, and the North Carolina Hot Sauce Festival. Granville County's commitment to excellence in its public schools through award-winning programs and charter options within the high schools is a source of pride for this community. Surrounded by rich higher education opportunities, Granville County is 30 minutes from Duke University, 45 minutes from the University of North Carolina at Chapel Hill, and approximately an hour from NC State University. Vance Granville Community College is less than 10 minutes away.
I'm Lee Isley, Chief Executive Officer with Granville Health System. I know you've heard about living in the region. Now let us share with you a little bit about being with Granville Health System. Our strategy is to employ a 5-pillar system, which focuses on service, quality, finance, growth, and people.
Granville Health System provides service throughout the region with compassion and pride. Additionally, Granville Health System actively measures its quality indicators, and our quality is comparable to national standards and neighboring big city healthcare services. Financially, Granville Health System is very strong, independently viable and thriving, which in turn has resulted in prolific growth, necessitating a multi-million-dollar master facilities plan to expand our presence in the community. In the 5-pillar system, the most critical pillar is our people. We place value on every stakeholder. That includes working with our medical staff to build their practices. We want mutually beneficial relationships because the success of Granville Health System is dependent on the success of our medical staff. As the flagship to Granville Health System, Granville Medical Center, with its 62 beds, has won awards for being one of the top 20% of community hospitals in the nation and offers all routine services, such as a bustling emergency department equipped to respond to any medical emergency. with a wait time well below the national average. Key relationships with nationally known trauma centers like Duke, UNC, and Wake Med provide ongoing care for the severely injured, with transportation readily available via a helipad for acute transfers.
The imaging department at Granville Medical Center takes pride in being service-oriented. We have an ethos of community spirit and trying to treat everybody who comes through the door as if they're our own mother or father or sister or brother. So all of us, from myself to the administrators to all the technologists, try to look at the patients that way and the referring physicians and try to give them the best service that we possibly can.
Granville Medical Center offers a full-service lab accredited by the College of American Pathologists. Granville Rehab offers physical, occupational, and speech therapy services to improve function, mobility, and conditioning in multiple locations throughout the county, with no wait time for appointments. Granville Medical Center also houses behavioral health services, a structured outpatient psychiatric treatment program that is staffed by an experienced psychiatrist and licensed clinical social and caseworkers. Through Granville Medical Center's state-of-the-art surgical services department, our staff is capable of performing more than 100 different procedures, from general surgery to specialties, and includes a pre-op area, 3 OR rooms, 1 minor surgical room, an endoscopic room, and a recovery area.
The thing about Granville Health System is it's very important to the leadership here to make sure that our quality of care is personal. And one of the things about Granville Health System is we offer MRI, we offer CT and advanced radiology services, we offer mammography and ultrasound, all of those high-tech imaging services that some of the larger hospitals do offer. But at the same time, we have that personal care.
Granville Health System received a 2009 5-star rating of excellence for quality outcomes in total hip replacement from Healthgrades, the nation's leading independent healthcare ratings organization. The outstanding score sets Granville Health System as the top provider for this service in the Triangle Raleigh-Durham area, validating our high level of quality care. Within Granville Medical Center's birthing center are 4 LDRP rooms with electronic fetal monitoring capabilities. By taking a family-oriented approach to the birthing experience, Granville Medical Center provides care and support for families before, during, and after the birth of their baby. In addition, Granville Medical Center offers a sleep lab, community alternative programs, as well as other diagnostic services. Our dietary department offers a unique catering-to-you restaurant-style service to our patients through a doctor-approved menu. While we consider Granville Medical Center to be the hub of activity, it is important to point out other components of Granville Health System. For example, Brentwood Nursing Center is a home-like long-term care facility named for Granville's first hospital and serves over 80 residents in both private and semi-private accommodations. There is also the Harold Sherman Adult Daycare Center, a program designed to provide care to the elderly and mentally or physically disabled adults. And through Granville Specialty Clinic, oncology, cardiology, and rheumatology outpatient care is offered in collaboration with Duke University Medical Center. Granville Surgical Associates is another facet of Granville Health System and provides general surgery and endoscopy services.
The administration at Granville Medical Center has actually been very, very fiscally responsible in these very difficult times that we are experiencing, where many hospitals are finding a problem in terms of doing well. Granville Health System seems to be doing extremely well due to the significant responsibility that the administration has in regards to providing for the optimal health care that we can in our community.
Other Granville Health System facilities include the South Granville Medical Center, located in Creedmoor, which boasts 2 distinct clinics, the Community Immediate Care Center, and the South Granville Specialty Clinic. Stovall Medical Center offers outpatient primary care to the northern region of the county, while South Granville Primary Care, located in Butner, services the rural southwest region of the county. By all accounts, Granville Medical Center may be considered a small hospital, but we have embraced new cutting-edge procedures that include vitreoretinal surgery, joint replacement surgery, and laparoscopic procedures. And by providing the quality of care one would expect to find in a big hospital and putting it in the intimacy of a small hospital that offers compassionate care, it is easy to see why we are the preferred healthcare provider, the employer of choice, and the preferred choice of physicians within our ever-growing community.
I've been in the Oxford area now for the past 4 years, and my practice has grown exponentially. I'm very busy both in the office as well as surgery, and have enjoyed my experience here.
This is the time. This is the place. This is the life. Come live where you can have a life as you work to promote healthy lives and save the lives of people that call you neighbor. This is Granville Health System, where our slogan, quality care close to home, is not words on paper, but words in action.
Our services are personable, accessible, and unique.
With a pleasant working environment for both physicians and staff, our employees are able to grow and to develop to provide the quality care that we represent at Granville Health System.
I can't imagine doing anything else anywhere else.
For a small community hospital, we are above and beyond the community standards.
Having been on the Board of Trustees as Chief of Staff for the past 2 years, I know personally that the Board of Trustees is very committed to the growth of the hospital as well as healthcare in general within the community.
Granville Medical Center is basically just a large family of physicians, and we treat our patients as our family.
The standards of care that are nationally recognized are met even in a small town setting.
The mission of Granville Health System is to provide the community we serve with the very best health care, delivered with compassion and pride. Granville Health System will be the preferred healthcare resource for the communities it serves, working in partnership with physicians and staff to deliver exceptional care. Our values: excellence, teamwork, respect, integrity, stewardship, and accountability. For additional information, please call 919-6